Thank you. Let's start again. Good morning, everyone. Welcome to the Human Services Committee, and we are live and ready to go. So, do we have a motion to accept the minutes of March 31st, 2021?
Motion.
Okay, Don and Daryl seconding. Thank you. All in favor?
Aye.
Thank you. So we're going to go down to public health. Did I see KJ? Morning, KJ.
Good morning, everybody. Okay. The first thing that I have is permission to backfill a nursing position due to retirement in June of this year.
So moved.
Thank you, Daryl. Do we have a second? Jay? Thank you. Don? All in favor?
Aye.
Okay, KJ.
Next, the only other couple things that we had, we are having a rabies clinic on May 1st. It is going to be out back here again. We're trying to use up some of the doses that we have before they expire. We will not be able to use up all the doses, but we are using as many as we can. I believe we have almost 200 people signed up for that. So that's a good thing. Just give you a little bit of update where we are regarding vaccination rates. If we go out on our vaccine tracker, the tracker and stuff, we presently have for 16 and above, it says 15 plus, but it's 16, and we're only using the Moderna right now, so that's 18. We are checking with the schools so we can start doing some pods at the schools if there's an interest for 16 and above with the Pfizer. So we are scheduling those. We're just waiting to hear back from the schools. But it looks like the total population vaccinated in the county, that this was as of Monday and stuff, was 42.2% for us. That's total in the county. And then as of, for our 65 and older, we are 60.9%. They do have it broken down per zip code and everything. So we're looking at that to see where we can stage some impromptu pop-ups with some good advertisement and stuff to really increase those rates and everything else. So you guys will be hearing from us. We will send out some information and everything when we've got those scheduled. We are continuing to do our farm pods. We had a very good one last week. We had almost 100 people, and we were like 98 people. So that was really good. We're doing another today. Not as many at this one, but we're keeping working at it and chipping away on it. As many as we get in is the more that we get done. So we're still working on those. So if anybody has connections to, we're hoping to do it at just large, trying to do it at larger farms, have people come there if we can, so we can get the biggest bang for our buck. So with everything, so we can, and it seemed last week worked very well. We had quite a few different farms in the area and stuff that came to Woody Hill Farm. So that was really nice. It was good to see. We had a lot of help with interpreters and stuff like that. So we're looking forward to going back, doing the second dose. And then, like I said, we're looking at reaching out. Today we are doing Ideal Dairy. Let's see, and I think we did do a pop-up at Granville Rescue Squad last week. That did not have, we didn't do as many as we had hoped to there as well. But again, it's timing, and we're trying to get better planned so we can give more notice out. It's kind of all the balls up in the air, juggling and stuff, but we're doing the best we can. So any suggestions or anything, we certainly welcome that. And I think that's all that I had, but Tina had a few things, so I will put it right over to her.
Morning, Tina.
So I have a resolution request to carry over the unspent funding from one of our COVID grants. It's a total carryover of excuse me, to about 230,000, and it'd be broken out into the different appropriation accounts. So I just need permission for that resolution.
So moved. Motion.
Jay, Daryl,
I'll second that.
and Paul seconds. All in favor?
Aye.
That didn't take long. Thank you.
No. And did you want me to speak about the EMS thing now, or do you want to wait for later?
Tina, why don't you go ahead and help clarify the discussion we had yesterday with that? Thank
Okay.
you.
I had done a little research. The ambulance Medicaid rates are not, set by the county. So I did go on to the New York State Department of Health website, and they are actually set by the state. And there's an email that the EMS agencies would have to send into the state to get those rates adjusted. So I did forward that information to Mark Spezio. So he has that, and they would have to submit their own justification as to why they think those rates should be increased. So I just wanted to update you on that. And again, he has the information. So it is a rate that's set by them, by the state, not by the county.
Thank you. And Tina, was the mileage, is that?
The mileage
Mark,
rate
that's
that was on his presentation is correct. Has not been reset since, I think it was 1988. So that is something that they can submit for with justification, and they can get that rate increased. It did state in the guidance that the rates, they don't really consider rate adjustments until the next state fiscal year. But if there are extraordinary circumstances, they would look at that and try to get those rates increased based on the justification.
Wonderful. Does anyone have any questions for KJ or Tina regarding public health? And go ahead, Daryl.
Good news on the vaccinations. Question, homeward bound, are we comfortable that we're able to get out there to the homeward bound folks, that population?
Yeah, our EMS has been working on that. We have a list of people that are homebound, and they're actually working on some more of those today. We send them the names, and they contact the people, and they're doing some in the Hudson Falls area today. We're going to try to coordinate that with our pop-up sites, but they have been doing that over the past several weeks. They reach out to the people and try to schedule the time that's best for them.
Thank you.
You're welcome.
Sam?
Yeah, so I'd just like to add to that. One of the issues that we are having with the homebound is calling the phone numbers and nobody seems to answer. So we don't know if we have the wrong phone number or what the case may be. So that's an issue. And if there's anyone, especially the supervisor chain, that knows of someone that is truly homebound that we can get to, please just give us a call and see if we can get a good phone number, and we'll go from there and reach out to them. Mm-hmm. We've had a significantly large number of individuals not answer their phones, and they've been called numerous times. So we're not sure if we got the right numbers or not. Thank you.
Thank you, Sam. Anyone else? Thank you for an excellent job. Well done. Okay. We're going to go from public health to, I saw Mike. Is Mike Brand here?
Yes, good morning.
Good morning, Mike.
Yes, I'd like to update you on a program that's a month old that you approved. It's in collaboration with DSS, the Pre-PINS program. This first month, we've had 6 youth referred, and 4 of the referrals are mainly school-based behavior, not logging in. During this time, it's quite common right now, and the schools are struggling engaging students, and the other 2 were parental referrals. And also the Safe Harbor program, which the coordinator shares both duties for both programs. So far this year, we've had 16 youth referred that are high risk for sexual exploitation. And where last year, the impact of COVID, there were only 24 through the whole year. We're already at 16 now. So I'll keep you filled in on that. As you plan for your summer rec programs, please don't hesitate to contact our office. If there's anything we can do to help support you, we'd be happy to. We have many games that are available that we can bring over and drop off for your rec staff to use, or we can provide direct programming if you like. So whoever you'd like to have, give us a call. We'll work with you as best we can. And on that note, Fort Edward reached out to us. They would like to bring their kids over to Lake Lauderdale. So we're planning a day over there to work with them and provide the kids an opportunity on the water safely and use the trails and use the park in total. The last thing I have is last week I finished up the Restorative Justice Circle training, Granville School. I believe it's their intention to implement it to handle school code of conduct behavior issues, and they also probably handle some minor police referrals too. But it was a great group of kids I worked with, and if any of the schools in your districts and your towns have any interest, I'd be glad to go over and give them an overview of what that process looks like. And that's all I have.
Thank you, Mike. Does anyone have any questions for Mike at this point? No? Okay. Thank you so much.
Thank you.
Okay, so we're going to go to Office of the Aged. Gina, good morning.
Good morning. Good morning, everyone. I'd like to start with a resolution request to amend the 2021 budget to recognize federal stimulus funds received through the Consolidated Appropriations Act, also known as HDC 5. At this time, I'd like to increase line .4400 by the amount of $28,836.
Okay.
This funding is 100% federal. It's 100% federal funding with no local match tied to it.
That's good. Motion.
I'll move it. Or I'll second.
Paul, Lester, Don, all in favor?
Aye.
Great, thank you. Okay, Gina.
Thank you. I do have one other item that is not on the agenda for today. I would like to share with you that every May, the Administration for Community Living leads our nation's observance of Older Americans Month, and the theme for 2021 is Communities of Strength. So at this time, I would like to make a request for the Washington County Board of Supervisors to make a proclamation in May, announcing May as Older Americans Month.
I'll move it.
Yeah, I'll second it.
Paul. Thank you, Daryl.
Yep.
All in favor?
Aye.
Thank you. I will be providing all the materials for that as well. Okay, next I'd like to move on to the 2020 annual report for the Office for Aging. We do have a PowerPoint presentation. Just to let you know that this presentation that I'm giving today is about 18 minutes long. So in case you're wondering about time. Every year, DSS and OFA engages staff to join in on a photo contest. Staff are asked to submit photos, drawings, etc. that commemorate Washington County. The photos, drawings, artwork is then placed up for vote in an anonymous manner. This year, we're proud to announce that Libby Casella, our staff development coordinator, submitted a photo collage that won the honorary status of our 2020 annual report covers. Next. We just can move to, thank you. As outlined on the screen, OFA and DSS have formed a partnership which makes us an Aging and Disabilities Resource Center, also known as an ADRC. I will be using the term ADRC and OFA interchangeably throughout my presentation today when talking about our department. The collaboration between both departments is successful in providing a one-stop shop for addressing the needs of our community members. Our co-location of staff and the training that they receive from both DSS and OFA and their prospective state agencies gives all of our staff a wealth of knowledge to provide well-rounded services. Please know that our departmental structure is unique across New York State. I will speak more about our partnership further into today's presentation. Currently, I'm going to focus only on the programs and services that OFA takes ownership of. Next. The funding of the ADRC is supported by state, federal, and local funds, and by a few grants. New York State Office for Aging is our official state agency that provides us with all our guidance and is our central funding provider. This slide shows a screenshot taken from the 2020 annual plan that I write every fall. The slide I am showing you now shows the federal funds supported by Federal Older Americans Act. The federal funds are listed across the top of the page, and the service categories are listed to the left side. Every year, our annual plan must include a projection of the total number of individuals served and the units of service. Every funding source has its own set of unique guidelines and rules. For instance, to the far right, you'll see Title 3E, and it can only be used for caregiver support services. In Washington County, we provide caregiver support in the form of personal care, consumer-directed in-home services, social adult daycare, case management, transportation, information and assistance, in-home contact and support. We provide caregiver trainings, and we also provide personal emergency response services, which is also known as medical alert. Change. Next, please. Like the previous federal funding page, here you will see OFA's state funds listed across the top of the page and the programs and services listed down the left side. State funds include expanded in-home services for the elderly program, community services for the elderly, congregate services initiative, and wellness and nutrition. The other funding category to the far top right includes grant fundings like New York Connects. Similar to our federal funds, every funding source and service category has its very own set of rules to be followed. Next. These stimulus funds were a direct cause of the National Emergency Declaration. During the emergency declaration, waivers were put in place and we were given permission by the state to use all federal Title III funds and our stimulus funds in the manner that best suited our department. Outside of the ADRC funds, we used our stimulus dollars towards our nutrition program. Next. Here you will see a one-page flyer that we developed to educate our community members of all the programs and services that our ADRC provides. When the public pause first started, we felt separated from our consumers, and it made us question how they were feeling being separated from everyone else. We went into action, and our office support staff who are working from home during the COVID-19 pause reached out by telephone to all of our home delivered meals consumers. We quickly learned from our calls that our consumers enjoyed hearing from us. We heard from several telephone call recipients that they felt a sense of safety and comfort knowing that someone was checking in on them. This made us ask ourselves, why not continue to do this? Fortunately, our state federal funding gives us the ability to provide this new service under the service type of in-home contact and support. Our staff now provide telephone reassurance, which is a regularly scheduled telephone contact made with an older person. This voluntary service is now offered to individuals with active cases. The calls that we make simply start with, how are you doing today? And conversations then lead to how's the weather, discussions about their family or friends, conversations around their pets, and how they are staying active and healthy, and so much more. Next. As mentioned previously, social isolation and loneliness was elevated during the COVID-19 pandemic. When local districts spoke out about this social issue, New York State Office for Aging took immediate action and distributed robotic companion pets to each local office free of cost. In addition to friendly calling, our interactive cats and pups are also a tool we have available to us to address social isolation and loneliness. These cats and pups are all about an ease of care and convenience that pairs with technology for the best possible experience. Data has shown that robotic pets have a great impact on reducing loneliness. If it is felt that a robotic pet would address someone's loneliness, our office has the ability to offer someone one of our limited supply of pets. Next. Now I would like to highlight additional OFA programs and services. To begin with, I'd like to speak about New York Connects. In 2020, our New York Connects Information and Assistance Program could not have been more needed. During the pandemic, DSS and OFA developed a plan to best serve the community. Based on the knowledge of community resources, it was determined that our New York Connects information specialists were key to connecting community members to available programs and services. This meant making phone calls to community-based organizations and finding out how they were operating and what they were providing during America's shutdown. From the information we collected, we maintained a resource directory and created documents like food pantry locations and hours, and also food delivery services that were being provided in our area. Next. Here I've highlighted 2 pages from the annual report itself that shows our 2020 New York Connects data. During the pandemic, information specialists continued to serve the public by providing information and assistance in areas like health insurance and benefits, home-based services, legal services, residential and housing options, and so much more. The chart on the top right shows the contacts we had with individuals age 60 and older and 59 and younger. In 2020, we served approximately 1,400 less people than in 2019, and we strongly contribute this decrease in people served to the COVID-19 pandemic. For obvious reasons, our main mode of contact in 2020 was by telephone. Next. As I shared with you when speaking about our New York Connects data, health insurance information and assistance was the top reason why community members call our office. Here I am showing you 2 grant-funded programs that we operate that addresses this need. The left side of the slide shows our health insurance information counseling and assistance program, also known as HICAP, which provides trained staff to offer information and in an objective manner regarding various Medicare plans. On the right, you will see information regarding our Medicare Improvements Patients and Providers Act, also known as MIPA. This program syncs nicely with our HICAP grant, as MIPA's goal is to look for and offer low-income assistance for Medicare beneficiaries. Our HICAP counselors are trained to meet with consumers and determine whether or not they are MIPA qualified. Next, please. Here is a snapshot that shows some of OFA's core services. I'd like to refer you to the actual report itself for a detailed description of each service listed here on this page. During 2020, legal services, transportation, and services for the visually impaired had some minor pauses. However, our medical alert program continued without disruption. New in 2020, DSS and OFA reassigned the DSS transportation services to the ADRC division. This allowed our community service workers to provide transportation services for folks of all ages with active cases under DSS and the ADRC. Transportation included grocery shopping, housing services, medical appointments, and family visitation for youth in foster care. The other half of the community services worker is to assist in the ADRC's New York Connects call center by making calls, taking calls, and requesting that for the community for a request on information and assistance for a vast array of provider agencies within our community. During the pause, the provision of transportation assistance was also paused. However, the workers remained busy as they were redeployed to assist with delivering meals to individuals age 60 and older through the OFA's Home Delivered Meals program. Also new in 2020 was the implementation of an enhanced multidisciplinary team, also known as an EMDT. Legal Aid Society of Northeastern New York was awarded funding to serve as the lead agency for developing an EMDT in our region, which includes Hamilton, Warren, and Washington counties. The EMD's purpose is to provide improved and effective cross-system collaboration, provide relief to the victim at the earliest possible juncture to stop abuse, and prevent further re-victimization. Next, please. OFA provides in-home services with the purpose of giving individuals the opportunity to age safely in their homes and in their communities. Here I've listed the providers we contract with for personal care assistance, social adult day program, and caregiver respite services. At least annually, we meet with each agency to complete what we call program monitoring. During the pandemic, we spoke with each agency over the telephone to check on their progress during the state's pause. Given the state's restrictions, social adult day services were suspended. However, surprisingly, in-home personal care services went without disruption for the most part. What we did experience was consumers requesting to pause their own services out of fear for being exposed to the COVID-19 virus. In those situations, our caseworkers made sure the consumer had a plan in place to address their personal needs. Again, I'm not going to go into detail about what all of these services offer, as this information is included in the hard copy of the annual report that you will be receiving. Next, please. During the pandemic, proper nutrition and accessing food was of great importance. During the National Emergency Declaration, the Home Delivered Meals Program was considered essential, and New York State waived eligibility to allow any Washington County resident age 60 and over to receive a home delivered meal. By lifting criteria for eligibility, we added 125 seniors to our delivery routes in just a matter of days. During the state's pause, our home delivered meals subcontractor CWI suspended their delivery services. This caused us to take immediate action to cover vital meal delivery routes. To address this need, we hired 4 additional per diem drivers. In addition, DSS and OFA staff jumped right in to help cover the needed routes. Today, we continue to cover 9 to 10 routes daily, and we serve all of Washington County. During the COVID-19 pandemic, all in-person gatherings were suspended, causing our meal sites to pause their services. With the flexibility of the home delivered meals waiver, we were able to offer congregate meal recipients a home delivered meal. In addition, we expanded the criteria for a restaurant dining program to allow dining members to use their tickets for takeout meals from local restaurants. To add, during the pandemic, Kristen Stewart, our registered dietitian, was busy working from home by calling, video conferencing, and developing plans for our nutrition education. She developed a YouTube channel where she has cooking demonstrations and recipes for everyone to enjoy. Kristen's nutrition counseling services went from in-person sessions to speaking with people over the telephone and using the traditional mail system to send out nutrition information. Next, please. Being a trustworthy agency for our community members is important to us. We do our best to offer emergency assistance in certain areas. The slide that you are seeing is taken directly from the annual report and shows a brief description of what these services are. New in 2020 was the distribution of PPE/masks and hand sanitizer. In response to the COVID-19 pandemic, New York State Office for Aging gave local offices a supply of masks and hand sanitizer. We distributed these items to individuals age 60 and older in our Washington County community. Next, please. Typically, our annual report has a lot of information to share regarding public events, and along with that came many pictures that have been taken throughout the year. In 2020, the only public events we had were in January and February. Here are only a few pictures that we have to share with you today. As you can see, we went to Winterfest in Lake Lauderdale. We worked with public health for Lyme disease presentation at Cynthia Meadows. We invited Legal Aid Society to join our pop-up event at Skeensboro Harbor for a presentation on living wills and healthcare proxies. And lastly, We worked with the Sheriff's Office for a canine presentation with Rusha and her handler, Deputy Earl. Next, please. May is Older Americans Month. It is time to honor and celebrate our senior ambassadors. We celebrated Older Americans Month differently in 2020. Instead of having our typical statewide celebratory event in Albany, we instead had a virtual live event on Facebook. Shown here are 2020 honorees, Carolyn Oderkirk from Fort Anne and William L. Cormier of Salem. Next, please. At this time, I would thank you for your time and attention to the annual report that I presented to you today. What I've shared with you is not all encompassing of everything that we do. It's truly just a snapshot of different pieces of what our division covers throughout the year. So I strongly encourage you to take a look at the annual report itself. The report is posted on our website, and you'll also be receiving a hard copy as well. Like always, please contact me with any questions that you have or any topics that you want to discuss further with me.
Thank you, Gina.
At this time, I'd like to tell, I'm not sure if anybody has any questions for me. If not, I'd like to pass the presentation on to Commissioner DeLorme, who's going to present for her DSS annual report.
Did anyone have any questions for Gina? Brian, yes, go ahead, Brian.
Excellent job, Gina. The pandemic's a very trying time. You had to get very agile and make things happen that we weren't used to making happen. And just a great job on your part and your team all around. Really appreciate that, and I'm sure our communities do too.
Thank you for your kind words.
Gina, I want to add to that. When we were doing the vaccination distribution sites, when the elderly came in, sometimes they didn't have their New York State ID paper, and they were a little concerned about how they were going to get their vaccination. And then all of a sudden they would say, but we're here from the Office of the Aged. And it was like, okay, that's a go, go to get your vaccination free card, and we couldn't have been happier with the amount of people that you sent that way. So thank you very much for your dedication to our community.
Thank you very much.
Anyone else?
Good, Carol.
Darryl, go ahead.
Yes, Gina, thank you for that presentation. Very informative. I look forward to reading the report. Question is, we're kind of in this for the long haul. We've changed the way we do business. We kind of need to look at this as being a sustained effort. Is what you're doing sustainable, particularly with the home delivered meals? Or are we being resourced properly to sustain these efforts that you've tried to, the adjustments that you've made? How's that looking right now?
So at this particular time, we are covering, as I mentioned, 9 to 10 routes a day. There are certain areas in the county that we provide frozen meals to, and that's just given the fact that for staffing purposes, like we provide folks with 5 frozen and 1 hot meal per week. I would like to have a discussion in the future with the committee around turning some of those per diem positions into part-time positions, just because we're covering the routes. I don't foresee at this time CWI continuing with the contract to help us service some of those routes.
Oh,
I hope that answered your question.
No, absolutely. That was spot on what I was trying to hopefully use out of you for Brian and his budget work.
Yes, thank you.
Gina, I had one other thing about the restaurant coupons.
Yeah.
What a wonderful way to support our local businesses in Washington County and provide for our seniors. I didn't realize that existed and was happy to see that, because that is a win-win-win situation. So thank you.
You're welcome. And I absolutely agree. And exactly what you said, it's a win-win, is exactly how I describe the program. It helps our folks in the county, receive a nutritious meal at a time of day that's best for them, and it supports our local restaurants. And so pretty much when we hear about a local restaurant evolving in Washington County, we're at their doorstep having a discussion with them about participating in our program. So we do have a limited number of restaurants who participate by their choice, but most certainly if you have a conversation with a restaurant and maybe they've changed their mind and want to participate, we will welcome a conversation with them.
Thank you.
Thank you.
Someone else trying to ask a question? Debbie, Al, or? Okay, we're going to move on to Tammy.
Okay, thank you very much.
Thanks, Gina.
Good morning.
Good morning.
So I think Gina said she had 18 minutes. I've gone through mine once or twice, and I barely can get through it in a day.
Don't say that. We want to keep everybody here until you're done.
All right, I'll do the best I can to keep it short.
Thank you.
What I have, yeah, Debbie's got it there. The next slide. The next slide, Deb. Thank you. So what I have here, it says on it that it's the abridged version. It is extremely abridged, aside from my telling you that it takes a whole day. We do have the full report has been printed, and there is a copy of it in all of your mailboxes. If you are not coming to the building and would like for me to pull that back out and mail that to you, I certainly would be happy to. It is, I think, beneficial, particularly with you being on the committee, to be familiar with the programs that we offer. And there's certainly quite a lot of information in that report. So the next slide starts off with the mission for the Washington County Department of Social Services. The key terms that we focus on here include empower, collaborate, self-sufficiency, maximize resources, and optimal outcomes. The regulations that govern our programs are, for the most part, quite clear, but they do come from 3 separate governing state agencies: the Office of Children and Family Services, the Department of Health, and the Office of Temporary and Disability Assistance. So what we know is that when we strictly apply the guidelines for one program, it can result in a counterbalance measure being required in another part of our department, so that they can meet their requirements with the family that they're working on. With that, we also have an overall agency goal that is to create and maintain a single agency focus across all divisions, seeking to provide the most effective services and supports for clients, resulting in safety, empowerment, self-sufficiency, personal responsibility, and independence. And we do find that guiding philosophy is quite effective in centering our approach. When I talk to my counterparts across the state, I think that the way that we operate our programs is of great benefit to our community, to the people that we serve, and also, I think, for the people that are providing the work in our programs, it gives them a much more supportive work environment than just working within the silos that are presented to us by the state. Next, Deb. This is the organizational chart, and it looks different in 2020 than what it had prior to that, with the reinstatement of the Director of Administrative Services. That has proven to be beneficial many times over with the development of the plans that are always required for our state agencies, and that was what we had expected, and in large part why the position was reinstated, but most especially with a deluge of directives that came to us with the pandemic. Also, and Gina had mentioned this as well, it's always important to recognize that Washington County is unique in our progressive approach of mixing staff and programs with 2 different county departments within the Aging and Disabilities Resource Center. It is through the MOU that was developed several years ago. I think Chairman Hall was a young man at that time, but he was involved, quite younger man than he is now. at that time involved in this process. So it's been around for a while. It is just between DSS and OFA, and Gina oversees the employees and programs that are part of DSS. It's all pretty fresh because Gina just went through that in her presentation. The MOU that I just mentioned also resulted in the combining of the DSS and OFA budgets and the administrative support of the budget being completed for both agencies by the DSS accounting team. This slide is a very simplified version of our 2020 budget. I'd like to mention that the cost savings measures that we had, I've spoken with you about in the past, about keeping a number of positions vacant throughout the year, along with some other efforts, allowed for a sizable transfer from the DSS OFA budget to the county fund balance through a resolution that happened in September. Also, quite notable is the increase in the federal medical assistance percentage, or FMAP, through the Families First Coronavirus Response Act, which saved $25,000 a week for the second half of the calendar year in the payment that the county makes to the state towards the cost of Medicaid. And that helped to somewhat balance the 20% withhold that the state implemented in August. So setting aside the county share of Medicaid, which is what we do in this report, the net cost of the DSS OFA programs for 2020 was just under $4.8 million. It's important to recognize, as we always point out, especially when we're asking for something, that the overall reimbursement in this chart, it shows 75.34% from the state and federal government for the provision of these programs is also quite beneficial. Next. This is some data related to Child Protective Services. This chart actually does not appear in the annual report that I have provided to you in print. I wanted to pull together a comparison of 2019 to 2020 for this purpose of this presentation. And so one of the things that it's always important to make sure people understand is that for us to investigate any allegations of maltreatment or abuse, we must first have a report. Reports come in through a state central register, which are then filtered to us, to the local county where the child that's in the report resides. The number of reports in 2020 was lower than what we had in 2019. It was a statewide phenomenon, and I dare say it probably was nationwide as well. Reasons for this have been bannered about by many, but we do know from the data and surely from our experience over the last year was that the situations we encountered with the families that we were working with were much more complex and overall included more instances of law enforcement involvement and misuse of drugs and alcohol. You can see that the number having increased for the total number of reports alleging drug and alcohol misuse. Though everything else is down, that is the one number that went up from 2020 or from 19 to 2020. Also included here is the snapshot of the chart where we show by, I think it's pretty largely broken out by zip code where the number of reports are and where we spend our time. Next. With Child Protective comes a need for Child Preventive. The goal being to avert families from further involvement with the child welfare system. We work with all manner of community providers and collaborate for our families. And we rely pretty heavily, though, also on some intensive preventive services that we have through 3 contractual relationships to include Northeast Parent and Child Society, Berkshire Farms, and the Washington County Youth Bureau and Alternative Sentencing. So these numbers will probably be mirrored in some cases, for instance, within Mike's report, showing that these are the kids that he is providing a lot of services to. Next. Foster care statistics. Interestingly, the same number of youth entered foster care in 2020 as did in 2019. However, the number that were discharged throughout the year was dramatically reduced. So overall, obviously put up our average number of children that are in care on a monthly basis. Next. Child support services is another program that's provided within the department. The total for child support collections for 2020 was over $8.4 million. The number of cases at the end of the year increased, as well as the number of children in open cases having increased. However, the number of petitions that we filed throughout the year was dramatically reduced, and largely because of the pandemic and courts being closed through the majority of the year. Interestingly, in 2020, over $757,000 was collected in child support payments as a reimbursement to benefits that were provided to families through either a child being in foster care or families receiving temporary assistance or medical support. And one thing that is hugely increased this year is the amount of federal refunds that were collected. And that is largely because the incentive payments or the stimulus rebates were not exempt from past due collections for child support. So if someone had a past due child support obligation, their stimulus would have been reduced or perhaps completely taken by that amount that they owed for child support. Next. New York Doc Submit is something that had, I think, been in the pipeline and planned by the state, but was put on a fast track this past spring, to be able to support the needs of people to stay in their homes, but yet have access to our systems and submit documentation. And while we were optimistic about this, we also weren't really sure it would be embraced, but it has been very beneficial. It's a program, it's right in the app stores. Anybody with a smartphone are able to upload that onto their phone and then submit documentation to us. It goes right into our repository here, and then we are able to index that into our automatic imaging system that we have. Next. For SNAP, the Supplemental Nutrition Assistance Programs, the total benefit provided, again, as I mentioned with another program earlier, was dramatically increased in 2020. The amount paid out to residents of our county through these SNAP benefits is all federal dollars, was $12,463,000. And you will remember that I had spoken to you in the past about the federal emergency supplement benefit, which increased everyone's amount of monthly payment to the maximum level. Whereas in the past, with past practice and procedures, if somebody was working, if their income level was higher than the minimal amount that's allowed with SNAP, their amount of SNAP benefit would be decreased in comparison to that. And so throughout this past year, everyone was allowed the maximum amount. And I'm sure that was something that happened nationwide. Next. Temporary assistance, that is the cash benefit that the department pays out to people, traditionally looked at as welfare benefits. These are the funds that help support rental costs and cost of living for families who qualify. The total expenditures in 2020 were $2,479,000. That breaks out into two different allocation categories, one of them being TANF, which you can see at the bottom of the chart. There were 163 TANF cases, whereas safety net cases numbered 175. TANF is 100% federally funded, whereas Safety Net is much more county funded than state funded, and there are no federal funds for that. So that total expenditure is reflected within our budget. Both the appropriation category and revenue are accounted for within our budget. One of the things, and I mentioned this in the report as well, one of the things that I hear quite commonly from the community will be where someone talks about having been in line at a store and seeing the person in front of them use a credit card that is associated with their benefits. It's the electronic benefit transaction. They call it EBT card. And people will often question the things that the people that they're watching are purchasing. So it's important to realize that in addition to the SNAP benefits that are on there, quite often it will also be a component of this cash benefit. So while the cash is given to them to help support with the intention of supporting additional needs and their rental assistance, they may have some other process of how they're utilizing that card. And it can at times look a little, I think there's awful lot of disbelief that people can be using them in that manner, but it is something that by and large is allowed and protected. Next. So then looking at the total benefits of the programs that we've just talked about between the temporary assistance, SNAP, HEAP, and daycare. Temporary assistance and daycare are both reflected within the budget, whereas the SNAP and HEAP benefits are not. That neither of those amounts filter through our budget. So that's also 100% federally funded, just like daycare is, but daycare actually does go through our budget differently, again, probably because of some way that the state or the federal government has set it up. Next. We do have an investigations unit, and ultimately the purpose for them is to ensure that people that are applying for public assistance receive what they are entitled to, and that people that are not eligible do not receive benefits. So we work together with within our agency with traditional fraud detection mechanisms, and then when we have concerns, we will also work with the district attorney's office and the sheriff's office. They have set designees to be able to work with my team. And when they look at the cases, they decide whether or not it's something that they should proceed criminally on or whether we should proceed administratively. And in all cases, then our goal is to collect back any benefits that were paid out and shouldn't have been. And you'll see that 19 cases were referred for criminal prosecution in 2020. Next. Adult protective services, much like child welfare, the number of referrals that came in decreased through 2020. Again, we probably could come up with any number of reasons why that is. Certainly a lot less public contact with people. And if you suspect that a person has a physical or mental impairment and can no longer protect themselves from neglect, abuse, or hazardous situations, and they have no one else willing to assist them responsibly, we will investigate that situation. The phone number is there. Those reports come in directly to our call center, and an APS worker would be able to talk with people that call in and then follow up to see what services are needed. A few final thoughts. I wanted to touch on the fact that when the pandemic really kicked in and the access to the building was limited, all of the supplies that were in the DSS food pantry were moved to the WIC building and combined with the LEAP food pantry. And that has been a continued process through to this point. A final resolution to where the food pantry will be located and whether or not there are still two separate food pantries within the county building is something that continues to be discussed. Also, a team that I didn't mention within our report that we just reviewed is our employment workers. And largely the number of waivers that have been in place throughout the last year has eliminated a lot of the traditional tasks that they would do, but we have utilized them, kind of redeployed them throughout the department, and they have been great assistance in other areas where they have been able to oversee some of the busier areas like our SNAP program. And one of them is actually specifically designated to work with the ESG funds, the funding that I've spoken to you about in the past that is available to help people cover the costs associated with housing that are not eligible for our traditional funding. I'd like to say I'm incredibly proud of our staff and their ability to flex to the needs of the county over the last year. As Gina has said, we've delivered meals. We've also helped staff a helpline for the vaccination registration. And we've had people making calls to follow up with any quarantine type situations for public health. I really hope that you'll take a look at the full report. Does anybody have any questions for me?
Carol, go ahead.
Tammy, thank you. Really appreciate everybody's efforts. Question is though, on the food pantry program, are we mixing apples and oranges in there, or is there something systemic that would prevent us from what, we did a practical matter, right, of combining food pantries? Is that still practical moving forward, or are there systemic reasons why we couldn't sustain that?
I think sometimes apples and oranges are available at the food pantry, but beyond that, it's just been a historic process that there are two separate food pantries in the building. The systemic aspects of that, I think, are getting whittled away at as LEAP has been able to increase the access to their food pantry. The differences between ours in the past was that ours was available at any time that the building was open, and LEAP had staffed theirs with volunteers and had more limited access. So opening it up, for me, the thing that we need to achieve is that there is wide access to a food pantry here in this area. So it doesn't have to be through DSS, it can be through LEAP. Space for it, I think, is one of the big issues for the county, and just the access. So I am certainly supportive of there just being one, and I'm happy to have that be operated outside of my department, but I do want to make sure that we don't lose access in that process.
Thank you.
Bob?
On the fraud investigations, I think that's a great idea because it gets the money back to people that really ought to have it, not people that don't. But you list $47,000 of potential returns. On an average basis, what's your actual return percentage-wise of actually getting some of this money back?
I think that varies based on the case and the outcome in court. When it's that sort of a situation, we set up a payment procedure with people, so it requires people over the long term to pay that off to us, and our process is limited to if they don't pay us. If we're doing this administratively, they don't pay us, we have very few things that we can do to them other than when they come back to us to apply again, we will collect that money from them at that time. The rest of it, I know that there are times that payouts are happening directly in Fort Edward Town Court to repay the amounts that have been erroneously provided. So it varies. Sometimes I think we're getting 100% back from people, and other times it probably takes years to collect back the money.
Okay.
Brian?
Yeah, well, since Bob went there first, I'll go there too. I think a bigger thing that, some people don't realize is when that hits the press, it's also a big deterrent for the fraud. And it has a real huge benefit also. But one thing I wanted to mention was, I don't know if everyone realizes here, unless you work with other counties once in a while, our department has worked together great here, and Tammy's one of those. And, I thank Tammy for helping out with public health, and Gina also. I mean, this is a big thing that when our department has worked together, it really makes a big difference. And there's some counties where those things don't actually work that way. And we're used to it, but we hear some horror stories when we get to some meetings outside the region, and so we're very thankful for that. And other question I had for Tammy is, do you think the stimulus money had an effect on the amount of referrals in some of your places, because money was already out there that some people weren't coming in after? Do you think that had some effect or no?
Yes, I think that the stimulus, having access to the stimulus, and then situations where people that were on unemployment received the higher amounts of unemployment benefits, all of those things certainly combined to have fewer people coming to us to meet their financial needs.
Any other questions? Tammy, I second what Brian said. With all of the department heads this past year, you've all worked together very well for as long as I can remember, even before I became town supervisor. But this past year has been totally a different, year. I mean, and for all of you to come together and do what this county needs and our communities need, I can't thank you all enough. It's been amazing to watch and to be a part of, and thank you. So.
Thank you for recognizing that. We've got a great group of department heads, and as you said, this last year has been different. I guess that's out of crisis comes opportunity, and it has been really reassuring for us to be able to work together in the ways that we have. And I think that it's really helped our employees as well to see how we can together work and provide, so much more support to the people in our community.
And I certainly agree with all of that. Thank you.
Thank you. Thank you, KJ.
So I do have a few other things.
That's what I was. I have my list here. Go ahead.
I have received a resignation from a caseworker. The timing did not coordinate with my being able to get it onto the official agenda, but I would like to request the backfill of the caseworker opening. I have talked with Danielle about this and bringing it to you for this request. I know that it would need to be forwarded.
I'll make the motion.
Thank you, Darrell. Brian seconds it. And
Thank
Paul?
you.
Okay, all in favor?
Aye.
Any opposed?
Thank you.
Thank you.
I also wanted to let you know that the heat season has been extended. It is now supposed to continue until the end of August, or until all funds are exhausted. This brings an additional grant with it. So there's a total of 3 grants available to people if they have not received HEAP at this point. Anyone who has received it and hasn't gotten the third or the second even grant, they have access to that, and you can refer people directly to our HEAP queue here at the office, and that's 746-2236. One of the things that we did find with HEAP being extended as long as it was last year, it really set people up to be in a pretty good situation so that it wasn't as crisis oriented for them when the weather got cold again. So there's at least some good in this with these things being extended. Also, there is an emergency rental assistance program. They're calling it ERAP, that is being set up federally, and it will be opening up in New York State in mid-May. I'm not sure if this is something that any of you have heard about yet. The state is going to have a web-based portal portal that tenants and landlords can apply to for retro rental assistance. They're going to be able to request payments for 12 months of back rent, as well as 3 months of prospective rent. There are qualifications and eligibility criteria with that, but it certainly is a huge safety net that is being offered to both the renters as well as the smaller landlords that are out there. The state has directed DSS to provide outreach about this program and assistance to people to apply for it if they are not able to do it on their own. I received notification last week that the state has allotted $120,000 to us to provide that outreach and assistance. So we're in the early stages of planning. I'll certainly be reaching out to board members to be able to share the information in your communities. And I know that the state is also planning a huge campaign to be able to share this information. They are not ready to provide us with the actual address for the web-based portal. So it makes it a little difficult, but they want us to share this information. Essentially, they're telling us be ready so that when we say on your mark, set, go, we're ready to roll out there with a bunch of information. But right now our hands are a little bit tied. And last, I wanted to touch back on the emergency broadband benefit program. It was something that I mentioned in the past about having been brought to my attention through Jason Guzzo from Hudson Valley Wireless. The Emergency Broadband Benefit Program is a Federal Communications Commission program that provides temporary discount on monthly broadband bills for qualifying low-income households. If households are eligible, they can receive up to a $50 a month discount on their broadband service and a one-time discount of up to $100 for a laptop, tablet, or a desk computer, with a small copay being required. Only one discount and one device discount is allowed per household, and the FCC expects the enrollment for the Emergency Broadband Benefit Program to open later this month. It's going to end when the fund runs out of money, or 6 months after the Department of Health and Human Services declares an end to the COVID-19 health emergency, whichever is sooner. So when we were originally contacted, this was something that it was felt my office would be able to assist in getting the word out and identifying people that could benefit from this. I think that it's become a much bigger thing. Really, I'm not sure that DSS is set to necessarily grapple with this, but we will certainly be able to stay apprised of what is available and share information with people when they are asking us for that. If there is a way that we can help people within your communities access this, we'll certainly help them, just as we always do. Gina's certainly well poised with the call center to be able to help people as they call in with needs, as well as the rest of our staff. It's what we do. So I wanted to let you know that that's still out there and kicking. It hasn't opened up yet, and I'm not quite sure. I don't necessarily see us having pallets of iPads delivered here to the county building that we'll be distributing, but there certainly will be some sort of need for us, and we'll do the best that we can with it. That's all I have.
Anyone have any questions for Tammy on any of the information she just gave us? One question, Tammy, on the landlords. Do you know if it's solely New York State landlords or out-of-state landlords?
I don't know the answer to that, actually. I know that they're saying preference is the first 30 days, the priority is going to be upstate New York. It's going to be landlords that have 20 units or less. And it's going to be people that, the renters that are at 50% or below of the AMI. After that 30 days, the AMI percentage is going to increase to 80%. And I think then the floodgates are going to be lifted for New York City. to be able to apply as well. So the first 30 days of that period is going to be critical. And at this point, they're looking at the middle of May. The eviction moratorium has been extended again. So it's the good news and the bad news, I guess. At least this money is money that can be used despite the fact that there's an eviction moratorium, whereas the ESG funds that DSS received previously cannot be used during the moratorium. So at least people are going to hopefully be able to maintain stability and stay in the places that they're in, and landlords are going to be able to collect that back rent.
Thank you. Any other questions for Tammy? Thank you very much. Great.
Thank you.
You're welcome.
It was less than a half a day.
It's not lunchtime yet. And everybody has their books in the mailbox.
Yes, please look at the books. There's a lot of work reflected in there.
Yes, both of them are very, very well done.
Thank you.
Thank you. Is there any other business for the committee today? I see Rob on here and Ken on here. Either one of you have anything to add?
Hey, it's Ken.
Hi, Ken.
One thing I would like to add, just to bring to everybody's attention real quick, is the peer-to-peer, Adirondack peer-to-peer program is having another free fishing license event. I have printouts available that you can contact my office for them. You can also contact Adirondack peer-to-peer coordinator Nicole Trottier. But the event is at Dick's Sporting Goods at the Aviation Mall on May 6th from 4 to 7. Any honorably discharged active duty soldier, Marine, any veterans just need to bring their either proof of service or proof of their DD-214, excuse me, and their license. And the program will be providing the free fishing licenses through Dick's Sporting Goods.
Thank you. Very nice. Anything else, Ken? Or any questions for Ken? No? Go ahead. Ken.
All right, thank you. That's all I have.
Thank you very much. Good morning, Rob.
Good morning. I did not have any agenda items. Just appreciate participating and hearing the information.
Thank you very much. Okay, so I think if there's no more questions, we will take a motion to adjourn.
No, we won't. We'll just adjourn.
We're just adjourned. That's about it. Bye, everybody.